Welcome to the CONNECT Collaborator Interview Series, where we host 10-minute conversations with healthcare professionals and partners with the goal of encouraging deeper collaboration in the healthcare industry. Today's guest is David Lee. David is the founder and chief collaboration officer at Health Collaboration Partners. This organization helps healthcare nonprofits, startups, and biotechs increase funding support, optimize multi-sector collaborations, and effectively communicate scientific impact. Over the last 30 years, David has secured funding for, created, and led numerous impactful large-scale public-private partnerships across a number of disease areas and has raised over $50 million for corporate and government sources, with more than 100 scientific multi-stakeholder projects. David, welcome and thanks for being here.
Hey, great to be here and great to connect with you, Lorie. Thank you.
Excellent. So I wanted to start by first acknowledging our connection. We worked together previously on a global initiative to improve patient outcomes in healthcare. So my first question is, why do you believe collaboratives are important?
Yeah, for me, I've learned, and I think it's a kind of a strand of my DNA throughout my professional career, the idea that you can do more in partnership than you can do alone. And I think especially in this healthcare environment, we really have to figure out how to maximize both our financial constraints as well as our impact. So having things that everyone can get around to do together, that they can align around a common agenda and really put more resource, both in terms of financial and people, into an effort, I think I've really learned is the way forward. And nice to see, for instance, people that would be actually competitors outside of the room, inside of the room, kind of aligning and saying, hey, we've got a bigger vision. And the competition isn't among the, say in this case, pharmaceutical companies that have products in this space, but the bigger problem sometimes is awareness, education, policies that need to be changed that can help patients get the right care that they need and the right diagnosis they need.
In your current role as founder and chief collaboration officer at Health Collaboration Partners, what are the key services you offer to healthcare clients and how do they contribute to their success?
Yeah, so a lot of the work that I do is kind of fundraising related, because I have had roles where I was the senior staff or executive director of a nonprofit group that was raising funds from the biopharma sector, philanthropy, other groups. And then I've also sat inside a pharmaceutical company and really got to see what a business case value proposition needs to look like. So I would say probably 75% of the work that I do is fundraising related, either serving as a fractional fundraiser for a healthcare nonprofit, helping on the private sector side, go-to-market strategies, or connecting with key opinion leaders in areas that I have expertise. I've been in the osteoporosis space for about 12 years, so really know the field as well as all the players, both industry, KOLs, various nonprofit groups. So that's probably 75% of kind of what I do on behalf of my clients, and then also have worked to set up or optimize multi-sector collaborative partnerships. One that I'm doing right now is on cancer and caregiving that we'll be launching in a couple weeks via design workshop. And then I've also done a little bit of public speaking coaching, working with biotechs, scientists and engineers that need help kind of taking all of their very deep knowledge and insights and technical expertise kind of to that 30,000 foot level and being able to kind of communicate that more clearly. So those are kind of the three buckets of the kinds of things that I do for my clients.
Maybe you could expand a little bit on your second example that you gave around the workshop and explain how your approach to this optimizes the benefits it brings to the healthcare stakeholders as you go into these multi-sector collaborations.
Sure. So in that case, we are creating a new collaborative that's been based on a lot of work that's happened previously, large workshops that, I think aligned on a common set of goals, but didn't have the kind of implementation arm to be able to take that forward. So what I've been able to do is working with my client, the National Alliance for Caregiving, taking that model, or kind of creating the model of how can we have the various sectors participate, and then we've aligned around 3 focus areas: research, policy change, and health system practice change, and really figuring out, together, how can we figure out what that next lever is to pull to, because I think I've learned a lot as well that you need both, as we call, top-down and bottom-up approaches. So you need top-down, where that's, policies that work, that really drive, the reimbursement that the healthcare professionals need, but then also support that the patients' caregivers need, and national coalitions. But then also on the kind of bottom-up, you need that peer-to-peer education, digital and other kind of tools that will help people, more efficiently do the work and find the patients and kind of track them and make sure that they're getting the care that they need.
Could you provide some insights which you have of what you perceive to be some of the challenges and opportunities of collaborating across public, private, and nonprofit healthcare sectors, and how you might address them?
So I would say a big thing that I've learned from multiple collaboratives, and I've been everywhere from on the ground floor as they've been created, as well as have helped to optimize some. But I think the key thing that I've taken away, and that I think is a caveat for anyone that starts a collaborative, is you have to have a real vision of what you want to do and why this unique group of folks across the sectors are needed to be together. Because I think sometimes I've seen where that if it germinates out of one specific organization, it's just kind of an extension of that organization, and doesn't necessarily have the ability to be inclusive and to hear the voices of everyone around the room. And then I think the key is to really do kind of strategic planning on the front end to say, hey, we could do 50 things, but let's focus on 3 that are going to give us the most impact. So for example, when I ran a group called the National Bone Health Alliance in the US, we really aligned around working on a care coordination program called a Fracture Liaison Service, launching an awareness campaign for bone health, and doing some kind of scientific work around bone turnover markers. And there were a lot of other ideas, but I think we felt that let's really focus on these 3 big stakes as opposed to trying to do too much. And then I think the other thing that I've learned is that it's nice to get the financial support from the members, both the nonprofits and the industry members, but almost the people power is what really drives these collaborations. Because if you have industry partners that have commercial and medical folks across the country in the field, you have all these national nonprofits, you have leading key opinion leaders at major academic and hospital and institutions around the country, you can really drive a lot and can really make a big impact. Where sometimes when you're working for a national organization, and if you have a fairly small staff, there's only so much you can do at kind of a state or local level. And then certainly that also helps as you're driving policy change, and you're connecting with legislators to try to get legislation, or working with, in the case of the US, folks at Health and Human Services, say CMS, to get some policy change to bring a group that has 60 members that represents hundreds of thousands of people, as opposed to one organization that has 5,000 members. It really speaks, because it really is that volume of voices that really helps drive the policy change and the engagement.
So one final question for you, David, based on that, is where do you see the future of healthcare, and what does it look like to you?
Yeah, I think we're moving that way. And I think that the good part of COVID is I think we did learn how to do many of the things that would typically be an office kind of situation virtually. And I know, at least in America, a lot of that work has continued, and the digital tools and the engagement both with healthcare professionals and patients that I think wasn't quite so strong kind of digitally is there, and I think it's here to stay. So I think the good news is that I feel like we are in a more patient-centric kind of place, and we're going to keep moving in that direction. And I think as well, our ability to give patients the care that they need that doesn't necessarily lead to having to go to the office, and to be able to do that that's more convenient for the patients. And then certainly would say as well, the future innovation that we're seeing in healthcare is really enabling folks to not only to have more time at home and to kind of manage their disease in a more kind of patient friendly way than kind of some of the older therapies. You kind of were just hospitalized for quite some time to get those therapies, and now there is a lot more kind of inpatient outpatient, which of course also puts more challenges on the family members, the caregivers, the care partners that are around that patient, helping to manage their disease progression.
Well, thank you, David. So where can people find you?
Yeah, so easiest way is www.healthcollaborationpartners.com, which is my website. Also on LinkedIn, I would say that's the other kind of platform that I'm the most active, and would love to set up any time with folks to talk about some of their challenges, and really appreciate the opportunity to connect today and to be a guest on this new piece that you're driving forward. Thank you.
Thank you, David, and we look forward to following you on your journey.
Thanks.